Thank you so much. That was a lot of really great information. So the CDC has recommended that the vaccines be distributed in phases because there's not enough for the whole population right now. Can you please explain where kidney patients fall into this phased distribution?
Yes, thank you for that question. This is a complicated topic, so I'm going to do my best to answer it. I think the challenge of this is that it's really being decided locally in your community, in your state health department, in some cases. There is a national authority that's from the CDC, and it's called the Advisory Committee on Immunization Practice that makes recommendations for the flu vaccine every year. And for COVID-19, they have 4 different levels. And these are 1A, 1B, 1C, and 2. 1A is basically healthcare professionals, and there's estimated to be 21 million of those, and long-term care facility residents, of which there are about 3 million. After that, there are, in 1B, there is something called the frontline essential workers and people age 75 years and older. And then in 1C, the third category, we have people 65 to 74 years of age and younger people with high risk medical conditions, like chronic kidney disease, for example, or the need to be treated with dialysis or kidney transplant. And then the fourth category is, it's called phase 2, and that is everyone else that's 16 years or older, because that's where the vaccines have been studied. How your individual state is interpreting this may vary. So that's one thing that's very important to address. And in some level, even the county health department may be involved in this decision process. I think you should know, and it may be worth your review, that the National Kidney Foundation has made a statement on December 17th, 2020 on kidney patient prioritization for COVID-19 vaccines and therapeutics, which recommended that patients be advanced with kidney disease to a higher level from the 1C. So in short, the third phase, 1C, would be for most kidney patients based on the CKD guidance, except those who are 75 years and older, which would be in 1B. The NKF has been advocating for kidney patients, and specifically in-center dialysis patients and the staff, because of the need to travel to the dialysis center for their treatments, typically 3 times a week. That potential risk is the reason why those patients are prioritized the highest, followed by home dialysis patients, transplant patients, immunosuppressed patients with chronic kidney disease, and other CKD patients. So I think that it's important for you to know that this may all change as time marches on, and maybe we'll have some changes in how the vaccine is allocated at a national level that will come in the future that will help address some of this local differences, and that leads to some confusion, I think, in where you fit. But these are the kinds of questions you want to start to ask your clinicians when you interact with your dialysis care team and your transplant care team and your nephrologist.
Yeah. So the best place to get information on your availability is probably either from your healthcare professional or your state or local health department, it sounds like. That's great. Thank you.